Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about a specific type of nerve condition or nerve pain that is common after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button and turn on the notifications so you can catch all of our latest videos related to knee replacement surgery. So in this video, we're talking about a very particular type of nerve that is vulnerable during the knee replacement surgery process, and actually is vulnerable in all kinds of knee type surgeries, and can be vulnerable if you have a trauma, an injury to the knee as well. And that's the saphenous nerve. And the saphenous nerve is a large nerve that branches off of your femoral nerve, a nerve that's going to travel down your whole leg basically, starting in your thigh and travels down your whole leg. And it is a sensory nerve, which means it provides information from sensation coming from the leg, coming from the skin, coming from touch, pressure, movement, all those good things, pain, sensation coming from the leg up into the spinal cord, up to the brain. And we're going to look at one particular branch of that nerve. Is called the infrapatellar nerve, and that means under the patella, so under the kneecap. So this branches kind of under and around the bottom part of your kneecap, from middle to the outside or the lateral part. And why we care about this nerve is that it is possible, and it is not uncommon, for this nerve to be vulnerable and have some issues. So not thinking about surgery itself at first, you can have entrapment of this nerve. Entrapment of the nerve without surgery and just by itself is pretty rare actually, but it is possible and can lead to some pain in kind of that front lower part of your knee. And this can be treated in the same way that if you have issues with the nerve after surgery. So with the knee replacement, it's common after surgery to have a numb patch maybe a couple inches around, and this numbness, this patch of numbness, is usually on the lower part of the knee and on the outside or the lateral part. So the lateral lower part of your knee is this little numb patch, probably maybe about the size of a $50 coin, maybe a little bit bigger than that. And this is from trauma or cutting of that infrapatellar nerve. And so it's very common and very normal. The vast majority of people are going to have that numbness after surgery. And usually, in normal circumstances, this numbness kind of diminishes over time. The nerve tends to heal and regenerate, or there might be other branches from other nerves that help contribute, or you might still have some of that lingering numbness, but it kind of diminishes and you don't really even recognize it or notice it eventually. But unfortunately for some people, this can be a cause of pain and discomfort, and there can be a pain associated with that front lower part of your knee, and it can be persistent. And it's very uncommon that this is the first reason for this pain that your doctors or your healthcare providers might think of. It's not usually the first thing that they're going to treat or look at, but it is possible that issues and some irritation or some injury to that nerve is causing that pain. Now, what can we do to treat it if it is what we find out that might be what's causing it? Well, there's some conservative treatment options. So you can do different neurodynamics, nerve glides, nerve slides type stretches and exercises that your physical therapist can walk you through and demonstrate for you. You can do some manual, some myofascial release, some soft tissue massage to that area can sometimes cause some relief and decrease that irritation and pain. Kind of the next step up, you might have to use a local anesthetic or maybe a cortisone injection. Sometimes that can be really helpful and help relieve that pain and irritation to the area. And in more extreme cases, if you go through the diagnostic process and your surgeon or your healthcare provider really seems to think that this is one of the causes and one of the things contributing to your pain, is you can actually have some surgery to help kind of release and loosen up the muscles around the nerve so it's not being pinched anymore, not being irritated anymore. Other options are, something I saw in the literature is freezing the nerve. So something that's called a cryoneuroablation. So basically freezing that nerve so that it stops being able to send its signal, and in turn helps decrease that pain that you're experiencing. So this is a little bit of a, not completely uncommon, but a little bit rarer to have this particular issue, but it's something that one of my viewers brought up and was wondering about, and it is possible, so I thought I'd share about it. Again, that's infrapatellar pain, infrapatellar impingement, irritation issues causing branching from the saphenous nerve that travels down your leg. So not common, but definitely a possibility and something you might want to consider with knee replacement surgery. I hope you found this video helpful and insightful. Please be sure to leave your likes, leave your comments and questions below, and I'll get back to you. Thank you for watching.